So thank you again for that. It's a great round of presentations, and in looking those over, there was a focus on the role of integrated multiplex testing for screening pregnant women for hepatitis B as well as HIV and syphilis to eliminate risk for perinatal transmission. Vivek focused on community-based approaches and how multiplex testing can benefit that. Jabril focused on the importance of integrating point-of-care testing within simplified models of care so that we can expand access to care and treatment. And then Sylvia focused on the role of testing for key populations such as MSM and people who inject drugs. And we had a variety of questions regarding those different uses. But just to focus on the role of multiplex testing of screening of pregnant women, Masiani from Kenya, is the multiplex testing now getting scaled up in Kenya, or is it still only in pilot programs? What's the prospects of that becoming the routine way of screening pregnant women with the use of integrated multiplex testing, please?
Thank you very much for the question. For now, we are thinking on how to roll it out. When we did this, it was a pilot. And in that pilot, what we did was to showcase how good the multiplex is. And the test by then was not approved by WHO. We are now happy that this test has been approved by WHO, and now it is in use. So we are in discussion with the government, and the government is so much willing on how to implement the result that we had. And it is in process and it is in progress. Recently, we started testing of hepatitis, and I'm sure now the multiplex will be very useful in Kenya.
Mm-hmm. Thank you. You pointed out, you gave some data to show that it was more cost effective to have an integrated multiplex approach rather than single testing. Was that type of information very helpful in convincing the national government to move in this direction?
Yes, for sure it is. Because in such a time where the testing and all that and the funding toward the test is really limited, having something that is affordable is a way to go. And therefore, the results which we had, specifically how it can reduce in terms of the ANC at the ANC level, and also at the mother who was coming. And specifically in remote areas, it was a good way. And we are in discussion with the government, and it is so much willing to look at our results and see what we can do. And something else which I can say at this particular moment, especially when it comes to the testing, is that we do have diverse populations and diverse needs. And therefore, having a test that is able to meet, especially to reduce time and also to increase the sensitivity and the management of the patient, for sure, it is a game changer.
Thank you. Vivek and Sylvia, what's the status of hepatitis B screening of pregnant women, to your knowledge, in India, Vivek, or at least in your state, in Chennai? And then for Sylvia, are women screened for hepatitis B in Moldova? And is there a role for integrated HIV, hepatitis B, syphilis testing in Moldova? Thank you. Let me start with Vivek first and then Sylvia second. Thank you. So,
Thank you for the questions. In our countries, we test pregnant women with separate, for hepatitis B separate, C and B separate, and for HIV and syphilis is multiple tests. And of course, this is more costs. And we think in future we'll introduce multiple tests for HIV, syphilis, and hepatitis. But at the moment, we don't apply multiply tests for
Thank you.
HIV, syphilis, and hepatitis. Thank you. But
Thank
of
you.
course, the testing is accessible in the healthcare points, and all pregnant women are tested at the first trimester of birth.
Thank you very much.
Thank you.
Thank you. Babak, please.
So, as far as India is concerned, triple elimination has caught on only in a very few states. There are close to about 30 states. But hepatitis B testing is definitely happening. We have, I can't give you a number though, but all institutional deliveries are definitely screened for hepatitis B. But having said that, there is still a sizable portion of deliveries happening outside the institution where testing may or may not happen. But triple elimination is catching up. At least 3 or 4 states have taken it as a policy in their state, because health is a state subject. And though India is a big country and health is individualized to all the small states. So that's catching up. And we in Tamil Nadu are going to do that very quickly as well.
Thank you. Kuku, a quick question for you. We put in the chat, that multiplex testing is available from a variety of manufacturers, but Abbott is available here. And there were several questions regarding access. Can my country, such as Ghana, have access to multiplex testing? So as best as you can you give us some idea of the availability of the Abbott multiplex testing in various African countries at the moment, and what are the plans going forward for that? Thank you.
No, the test is it's a WHO pre-qualified, which is a key barrier to achieve in most countries in Africa. And also we are undertaking in-country evaluations in a number of African countries. These tests are, the tests that are contained in the ANC panel are tests that are already registered and in use as individual tests in many African countries. So it's the Determine Early HIV Detect, it's the Determine HBsAg2, and it's the Determine Syphilis. So they are registered and in use already in many countries in Africa. And so what we are focusing now is the usability of the triple panel. So allowing countries to test how this works within their health settings. And we have those studies underway in a number of countries. Ghana, which is where I come from, is also on the horizon for this kind of testing. And definitely we have representatives in all African countries who are engaging with the Ministry of Health in the first instance to be able to bring the tests like other Abbott diagnostics into countries that need it. Thank you.
Thank you. There are several questions regarding the availability of this test from Abbott in the United States.
So that is, yes, it's not really optimized at this stage for the United States. There are a number of other regulatory hurdles that would need to be met in order for it to be in the United States. But what we have now is the World Health Organization pre-qualification. So for countries in which that is significant, then we're good to go.
Thank you so much. The second stage of this was several questions and comments around family-based testing coming from maternal screening. And I'm going to turn it over to Jabril to, for you to comment about some of our plans for, looking at the role of multiplex testing in screening pregnant women, and then by extension, the family. Would you please comment on that, Jabril?
Yeah, it's very exciting to see that in other places the multiplex testing has been used in antenatal settings, and the general kind of like feedback is that it works very well from a provider point of view, and it's also preferred by the pregnant women. So we are looking to use this multiplex testing in pregnant women cohorts in parts of Africa, in Uganda initially, in antenatal clinics where we would be doing this targeted multiplex testing under the banner of the triple elimination agenda, and then hepatitis B surface antigen positive pregnant women would then be like indexed for decentralized risk-based testing for their household contacts, their children, their partners, and other close relatives. And hopefully this can like provide targeted care and intervention for them, but it also can like feeds into the integration and kind of like doing things in a coordinated manner rather than in silos. So multiplex testing at antenatal services where the pregnant woman will get all the care they need, but then using that as a stepping stone into the community to then provide testing for their household contacts and other close relatives.
Thank you. Ms. Iani, since you're a little bit further along in looking at integrated testing, have you thought about, and I know in many countries, I'm not sure about Kenya, there is outreach to family members when a mother is found to be HIV positive. Have you thought about the role of this integrated multiplex testing in screening family members for hepatitis B, given their high risk of household transmission of hepatitis B virus? Please.
Yeah, thank you very much for that question, because I have used these tests at a community level. Let me start with this, that during this testing, especially when doing this test, one of the main challenge was on how to link them to care. And when you tell somebody that he has hepatitis, then it's like, where did I get it from? What about my family members and all that? So we started it specifically when we were doing this pilot. We visited the families that were affected. We also linked them to care. And the definition of linking to care is we were able to take them through all the other tests, that is the LFTs, the viral loads, and link them to care. Not only that, we also vaccinated the children that we got from testing all this. So that led us to the second study, which I didn't present here. We did a community-based, and the result from community-based and what Gabriel has shown were actually so similar, that people were willing to take it up at the community level, and they were willing to be screened, to be tested for hepatitis, and also the other two tests. So this kit especially, which is the multiplex, is very useful, especially in following up. So if you have somebody who is positive, you can use it to go to the family members, especially the spouse and the other close relatives. I have used it and the results are amazing.
Thank you. Vivek, regarding community-based approaches, do you agree that it really has a lot of advantages for simplicity and linking the care of these multiple diseases in Chennai?
Clearly so. We don't have any doubts about that. Especially because, as I said, we don't have multiplex testing yet in India, though. So diabetes and hypertension, which is the NCDs, because MASH or metabolic associated steatohepatitis is a huge problem. Fatty liver disease is a huge problem. So we have now started screening for those things in the community. People always have this stigma of coming into a hospital. They feel the cost is high, and they feel that the hospitals are going to charge them more for various other things and tablets and medications and so on and so forth. So I think in the community they're a bit more relaxed. When we take the care to them, they trust us with their family, and it's easier for us to get them treated. And we always accompany with a qualified doctor. So in case of any doubts, it's clear then and there, number one. Number two is a linkage to care is for sure. So I think community testing is the best. Point of care testing is amazing.
Thank you. Ms. Iani, do you have another comment?
Yes, my comment on the community and also integrating it in HIV is about stigma. If we do have a very nice way to counter stigma, especially by including the counselors and taking through the person who we are doing the testing, the stages of counseling, it will really, really help. Initially, we had not foreseen that, but later, after realizing it and we integrated it into the process, it really saved a lot, and it gave us a very nice way of reaching out to many people. So countering the stigma will really, really help in terms of integrating this and having high success rate.
I think, Vivek, you touched on this. When you speak about community-based testing, is it more just outreach, like health fairs and sort of, right in the shopping centers, et cetera? Or does that also include primary care where people are coming in for general care? And then I could see how this would also be very helpful as a preventive service by primary care providers. So what's your concept when you speak of community-based testing?
Of course, earlier days we were doing, as I said, we used to normally would tie up with another social organization like a Lions Club or Rotary Club, announce a week ago as to such a camp is going to happen, and then we go in and in a common place, get all these people in and test them. But recently, what we've also done is tied up with the government of Tamil Nadu. And because they have primary care centers all in the peripheries. So they've given us access for the first time to go into their place and screen patients who are coming into the hospital setting also inside the government primary healthcare centers. Of course, we have a combination of both. I think community is good because even we do random testing, we still pick up patients. Because, as I said, a community in a hospital only a certain group of patients will enter. So I think it has to be a combination of both. I think, of course, a mall. I've never done a mall because I think people come for shopping. They never like to have their hand pricked, right? But small villages, schools, colleges, corporates, especially youngsters with various kinds of activities. So I think. I think multiple models are required to cover the entire population.
Yeah, thank you. Thank you all. We have just about 90 seconds left. So any last comments from our presenters before we wrap up?
There's a lot of interest in the Q&A and the chat about kind of like these novel diagnostic tools that can support decentralized hepatitis B service delivery in the primary care setting and the integrated. So I would just urge everyone to register to the coalition's newsletter and to keep track of the core Hep B studies. As we launch this, we'll be providing periodic updates. And yeah,
thank you. Well, and thank you all for a fantastic set of presentations, really tremendously informative and tremendously thought-provoking. So I really congratulate you on your work, and please keep it up. And